This depression test changes everything, and it's so much more than any depression quiz or questions being asked by your doctor about depressive symptoms. Hey, it's Dr. Kevin here. I wanted to share this quick video, and in this quick video, I'm going to basically reveal to you some tests that you can ask your doctor for that will help change depression for you if you have depressive symptoms. So let me ask you a question. Have you ever been tested for depression? Chances are the answer is no, because there's no one single test that could diagnose depression. In fact, no test can really diagnose any medical condition. When you go in to see a doctor, they're there for a reason. They are there to interpret your answers to questions, right? Your symptoms, and then typically what they should be doing is using testing to back up their hypothesis. That's how medicine has always worked. Unfortunately, today, a lot of physicians go straight for the testing, and they come to conclusions really too quickly without paying much attention to you and to patients. It's all about the patient. Anyway, there are no single one test for depression. There just isn't. And unfortunately, medical doctors, most GPs, general practitioners, are the ones giving out prescriptions for depression. And unfortunately, we know how that works out, right? They essentially work as well for most people based upon science and research as well as a placebo. And if you don't know where the problem lies with the diagnosis or why someone has depressive symptoms, it's kind of like having surgery and not knowing where to cut, right? I mean, think about it. So they're just giving you a pill hoping it's going to work. But if they knew where to look, asking the right questions, then testing becomes different. And using tests can help get to the root cause of why you may have depression or depressive symptoms, and then you can fix that, right? Because most physicians and people think that depression is between your 2 ears, it's all in your head, and guess what? I know as well as you do that it's not, and that's not true. I've been there. And unfortunately, most doctors are not looking deep enough because they don't know where to look. But there is a new theory on depression. It's called the cytokine model of depression. All this means is that the cytokines, this is a marker for inflammation. Basically, that depression is inflammatory in nature. There is inflammation in your body causing interference from your body, either not being able to make certain neurohormones or neurotransmitters to make you feel better, they're not being received, whatever it may be, but there is interference due to inflammation. So this theory is holding up a lot stronger than the old one, which is the serotonin model of depression, which has been debunked recently, and that's why medications were made. Anyway, I'm going to give you some tests that you can ask your doctor for that can help you at least investigate with your doctor's help to find out where the problem may be, why you may be having depressive symptoms, especially if you have chronic depression or clinical depression, and if you're being medicated, okay? So, we talked about cytokines. So how do you determine if you have inflammation in your body? Well, there is a test for it. It is called C-reactive protein, okay? C-reactive protein is a marker for inflammation in the body, and if you do have inflammation raging in your body, then you can focus on, hey, let's knock this inflammation out. There's a number of ways to do it, and that's not what this video is all about. It's just about giving you some helpful hints to ask your doctor for these tests so you can start peeling back this onion and trying to discover why you have depressive symptoms, okay? So C-reactive protein is one marker. It's very common that physicians can order for you. There's another one called IL-6. This is interleukin-6. It's another inflammatory marker, not as commonly tested for, but you can ask your doctor to test for that. There is one more, and it's called homocysteine. Homocysteine is typically run on blood panels, typically cardiac blood panels, because it could, again, point to inflammation as being a problem. So if you have inflammation, then you can go to work as far as treating the inflammation. You can either treat that, I hate to say it, but some doctors will treat it with medication. You can treat it with supplements. You can treat it with food. In fact, it's the best place to start because a lot of people that have inflammation, it starts with the foods that we eat, the beverages that we drink. So there you have it. You've got these markers to look for when you go to your doctor. Again, any GP can essentially run this panel for you. I'm going to give you one more test, or at least a series of tests or an area to look for that is very common, okay? It's commonly missed, and it causes depressive symptoms, okay? And this is looking really deep into a thyroid panel or looking for hypothyroidism, because one of the major symptoms of hypothyroidism happens to be depression. And I know this because, well, I wrote the book on it. In fact, I wrote a book called The Hypothyroid Diet, and I started writing on it because my wife struggled with thyroid cancer, Hashimoto's thyroiditis, and hypothyroidism, and we couldn't get her an answer. She wasn't feeling well. I dove into the research. Anyway, I went really, really deep on thyroid conditions, and there are a lot of times they are misdiagnosed, underdiagnosed, mistreated, untreated. So thyroid conditions, if you think you have one, okay, so if you have fatigue, if you have weight gain, if you have depression, constipation, cold hands and feet, these are just some of the symptoms, you need to find yourself a good functional medicine doctor, a good endocrinologist potentially, but make sure they're a functional medicine doctor and run a full panel on thyroid conditions. I'll do another video to dive deep into thyroid conditions, symptomology, treatment, and testing as well. But for this video, I just wanted to tell you about the depression tests that are going to help you, and start with C-reactive protein, look at homocysteine, and maybe they may run an IL-6 for you, interleukin-6, looking at inflammation as one of the major contributors to depressive symptoms and depression today. So again, the whole video here was to basically reveal these to you, but also to start thinking about how the medical model works. Okay? It can save you a lot of heartache, a lot of pain when you understand when you go to a doctor, if they are not testing you for something and just asking questions. I mean, if you think about it, it's crazy pants. Someone's diagnosing you with a condition like depression without running tests, just by asking you some questions. Don't you think that's a little silly these days? We're in the year 2022, depending upon when you're watching this video. We have lots of technology and tests that can help people. And that's one of the problems with mental health and depression. And I don't want to go down this rabbit hole and open up a can of worms here, because I'm starting to get very passionate about this. And the reason being is because I struggle just like you may be struggling now. I was able to come to a resolution and find why I had depressive symptoms. It's because there was something going on in my body, and doing testing and knowing, I was able to find it. But if I didn't find it through doing some of these tests, I may have been on medications, multiple medications, going for therapy. There's nothing wrong with therapy, but it can't fix a biological problem in your body. So anyway, I hope you found this video helpful. Hey, please do me a favor. Give it a thumbs up, share it if you can, because I want to get this video out to as many people as possible, because there's a lot of people like you potentially struggling, and we can get them off the hook or get them help just by getting this video to them. Make sure you're subscribed here, and as always, if you need additional help, hey, just go above in the banner, click the link, you can get back to my website, kevindobrinsky.com. There's lots of free resources for you there. If you need additional help, you can always reach out to me. There should be a contact page or an email there where you can reach me. Hey, I thank you for being here. I'll see you tomorrow. Until I see you again next time, I'm Dr. Kevin. I want you to eat well and be well.